Now to the coronavirus crisis. U.S. healthcare workers in nearly half the states are facing a federal mandate to get their first dose of a COVID vaccine by today.
The requirement will be rolled out across the rest of the country in the coming weeks. It will impact around 10 million healthcare workers at facilities subsidized by federal funds. The mandate comes at a time where the U.S. is experiencing its highest COVID death rate in nearly a year. The U.S. is averaging more than 600,000 new cases and 2,300 deaths every day.
But there is a silver lining. COVID cases are declining in many states and also around the world. Countries are lifting restrictions as the threat from the fast-spreading virus lessens. But on Wednesday, top infectious disease specialist Dr. Anthony Fauci said we are not out of the woods yet.
People ask that all the time. What is an acceptable situation with regard to SARS-CoV-2 and COVID-19, and in this case, Omicron, that we are willing to live with in the sense of not having it disrupt our lives? Well, first of all, the important point to make is that we are not there right now. As Dr. Walensky said, when you have over 2,000 deaths, 150,000 hospitalizations, and you have people who are now getting infected to the tune of somewhere around 700,000 a day, we're not there yet.
And joining us now is U.S. Surgeon General Dr. Vivek Murthy. Dr. Murthy, thank you so much for being with us. I just want to repeat the fact that around 2,300 people are still dying every day from COVID. That seems like too many when you consider the vaccines and the therapies that are now available. So clearly, we're not in the place we want to be yet with this virus. What more needs to be done?
Well, it's important to take stock of where we are, and we have thankfully come down from the peak level of cases from the virus, but we are still experiencing an extraordinarily high number of daily cases, nearly 700,000. We're losing nearly 2,000 people a day to this virus, and we have hospitalizations still hovering around 150,000, which is among the highest it has been during this pandemic. So while we are heading in the right direction, we're still not where we want to be. And what we need to do to ultimately get to a better place is we need people to go out there to get their vaccines and their boosters, because we are now seeing with Omicron in particular that these vaccines and boosters are saving lives and keeping people out of the hospital. We also need people to wear high quality masks, N95s, KN95s, KF94 type masks, and to wear those in particular when you're in higher risk settings, when you're in public indoor spaces with people who may or may not be wearing masks. And finally, we just need to use testing also in thoughtful ways. If you have symptoms, please get tested. If you've been exposed to somebody who has COVID-19, please get tested around day 5. It's one way you can not only protect yourself and identify yourself as somebody who may need treatment early, but you can also prevent yourself from infecting other people in the process. If we do these things together, we will get through this surge and we will get to a better day.
Dr. Murthy, we want to talk more about masks in a minute, but first, there's a new subvariant of Omicron called BA2. Can you tell us what we know about this so far? And does it worry you, or are there any other variants out there you're concerned about?
So BA2 is a cousin of Omicron. It's part of the Omicron lineage, if you will. And in some countries like Denmark, for example, we have seen the BA2 variant spreading quickly. And in fact, in some cases, spreading faster than its cousin, the original version of Omicron that we're dealing with here in the United States. The question is, what consequence does that have? There's nothing yet that has indicated that this variant, this cousin of Omicron, is more dangerous or that it's less responsive to our vaccines or to our medications. But we have to study this very closely. It's why we're working with partners across the world, scientists, to understand what they are learning. It's why we're doing a lot of research here as well. Currently, the CDC is telling us that the cases of BA2 are still very low in the United States. But we want to make sure we're learning everything we can about this so that we are prepared. For now, though, the message is still the same, that steps you need to take are still the same, which is to get vaccinated and boosted and to wear that high quality mask to reduce transmission.
Well, it's good to hear that the message is still somewhat the same, because we do know that Moderna, at least, is starting to test an Omicron-specific booster dose for adults. I'm curious whether you think this is an effective use of resources, because it seems like we could potentially be wasting time by creating variant-specific vaccines or tests when, by the time they're publicly available, there's a brand new variant on the scene. So what do you think about these variant-specific boosters?
Well, I'm glad you asked, because I certainly don't want anyone waiting to get their vaccine or their booster, because of the news that the companies are working on an Omicron-specific booster shot or vaccine. Those Omicron-specific vaccines will take time to develop, to test, and for us to know if they're effective or not. But the good news is that we have seen now very clearly that with the versions of the vaccines we have today, that they are effective at protecting people from the worst outcomes of Omicron, including hospitalization and death. And that's why we're urging people to go out there. But finally, just keep this in mind. The companies will develop different versions of these vaccines, and we want them as part of our broader pandemic preparation strategy to have various options. We never know what's going to come down the pipeline, but the more vaccine options, the more treatment options we have available to us, the greater chance that we'll be able to respond as needed when new variants arise.
We learned this week that the FDA is halting the emergency use authorizations for 2 monoclonal antibody therapies by Regeneron and Eli Lilly. Florida Governor Ron DeSantis says this was done without a shred of clinical data. Can you explain how the FDA came to this decision?
I'm glad you asked. Our goal should be to get people medicines that work and to avoid sending the medicines that don't work. And what we have seen now, clearly in the laboratory data, is that the 2 therapeutics in question, which are both 2 monoclonal antibodies, that these do not actually appear to work when it comes to Omicron. And that's very important here because we know in order for these monoclonals to work, they have to be able to bind the virus. But we're seeing in study after study that is actually not happening. The companies themselves that manufacture these antibodies have said that they do not work. The American Medical Association has agreed that they don't work. Scientists in the NIH have studied this, and scientists around the world have also looked at this and all agree that these are not appropriate therapies, that it would be not only a waste of resources to send these to people at a time where we have more than 99.5% of COVID in the United States being Omicron, but it would also subject patients to unnecessary risk. I know as a doctor, something I was taught very early in medical school is that you never give a patient a medicine if they don't need it. Because not only are you burdening them, but every medicine has a rare possibility of a side effect. And that risk is sometimes worth taking if there's a real benefit there. In this case, there is no benefit based on the scientific evidence. And that is why the FDA changed and revoked its authorization for these 2 monoclonal antibodies. Again, we want to focus on getting people treatments that work. And the good news is there are treatments that work. We have another monoclonal antibody made by GlaxoSmithKline that is effective against Omicron. We have another monoclonal antibody made by AstraZeneca that's helpful for people who are immunocompromised. We have 2 oral medications that work, Paxlovid as well as molnupiravir. And we have remdesivir, a medication which is administered through the vein, which has been shown to significantly reduce the chances of hospitalization and death in people who are at higher risk. So we have 5 good therapies that do work. We should be focusing on getting those to people all across our country, and that's exactly what the administration is doing.
And Dr. Murthy, there is an important bill in Congress to address the mental health of first responders. We know that this is an issue that concerns you as well, the Dr. Lorna Breen Healthcare Provider Protection Act. So how important is this in light of all the difficulties doctors, nurses, and many others are feeling? I mean, I know this is just anecdotal, but I have so many friends who have children either in boarding school or in college who say the mental health issues that they and their friends are going through are pretty extreme. So what are your thoughts on how COVID is affecting the mental health of Americans?
Well, I'm so glad you asked. And I want to talk both about our country more broadly, but about healthcare providers in particular. We know that this pandemic has taken a real toll on us, and we know about the loss of lives. We've seen the terrible numbers in terms of deaths and hospitalizations, but there are invisible wounds that many people have sustained as well. Stress, anxiety, depression, these have all increased for many portions of the population, including young people, which concerns me deeply. When we look at healthcare workers in particular, though, they were already struggling before the pandemic with high rates of burnout, and that has only increased for nurses, doctors, and others on the front lines in our hospitals and our clinics. The reason this is such a profound challenge for us is that it's not only that it makes it harder for people to get care now when they have COVID or other illnesses, but even after our pandemic is over, we're going to need our nurses and doctors to care for people who have heart attacks, pneumonias, infections, cancer, and other conditions. We need our clinicians to be well. And perhaps most importantly, these are the people who have stood by us during this pandemic. They have put their own lives at risk at times to take care of us, to make sure we are well, to save our lives, literally. And we have a moral responsibility to make sure that we are looking out for and supporting their mental health and well-being. That means investing in expanded access to mental health treatment. It means reducing the burden on many clinicians, which is in part reducing the number of COVID cases. That means everyone taking the precautions they're taking, but also reducing so much of the administrative burden that has taken many clinicians away from patients and put them in front of computers. Whereas what they really want to do is get back to caring for the people they got into the profession to serve.
Dr. Vivek Murthy, thank you.
Yes, thank you so much for joining us. We appreciate it.
Thanks. Great to be with you today.